Good day, I am Maricar Sino from 12L, and today I'm going to demonstrate about inserting a catheterization. The purpose of catheterization are to relieve acute or chronic urinary retention, installation of medication, to drain urine pre-operatively and post-operatively, to assess the amount of residual urine if the bladder empties incompletely, to provide for intermittent or continuous bladder drainage and irrigation, to prevent urine for contacting and insertion after perineal surgery. Prior to the conduct, I have already checked the doctor's order for catheterization. Now I'm going to wash my hands before I'm going to start prepare the set for catheterization to avoid cross-contamination. Next is I'm going to identify my patient by asking her name and checking her wristband to assure that I am in the correct patient. Good day, ma'am. My name is Maricar Sino, your student nurse for today. Doc Angel requested me to insert a catheter in you today. May I see your wristband, please? Can you state your name, ma'am, and your date of birth, please? Thank you, ma'am. Doc Angel requested me to insert a catheter in you today. During the procedure, I'm going to touch her private part, which is by me going to spread your labia majora so that I could see the urethra where I'm going to insert your catheter. This catheterization is allowing your urine to drain if you have obstruction in the tube that carries urine out of your bladder. Do you have any question or any clarification before we're going to start, ma'am? Okay, ma'am, thank you. Ma'am, when was the last time you went pee? Okay, ma'am. Ma'am, before I will start, is it okay to you that I'm going to close the door so that to have you a privacy and so no one could distract you during the procedure? Okay, ma'am. Can you lay down comfortably and bend your knee a little for me, please? Thank you, ma'am. Now I'm going to turn on the light for visualization of the genital area. Now take note, it is really important that you're going to only show the part that you need to be checked. And also you could form like a diamond on the blankie, so you could cover her and shows only the private part. Shows only the part that you wanted to be checked. And as you can see, there is a left corner on this pillow because I form it into diamond. You could wrap this in her legs so she won't get cold during the procedure. And ask her to step this to remain on the place. Now, it's time for me to open the tray, and I'm going to arrange the equipment for convenience and according to avoid contamination of the sterile item. But first, I'm going to put a towel for her buttocks to avoid wet. Hold only the tip of the cover of the tray to keep the sterility. So what I had here is the sterile forceps. Using my other sterile forceps, I'm gonna take this off. And what I had here inside is the eye sheet, and also the sterile gloves, and the cotton with the betadine, and also a gel for lubricant for the catheter. Now I'm gonna add a catheter here. As you can see, this is so close. You could actually open this and touch this one, because you had another piece of another part here that it's coming with the plastic. But you have to be careful and keep the sterility on this bag. So use some technique like dropping it on your sterile area and dump. And also I had a 10 cc of with solution in it to put inside later on the catheter. Now I'm gonna wash my hands. Using my forceps, I'm going to hold the cotton balls to clean the area with the betadine. It's really important that you're not going to repeat using the cotton. Now that I'm done cleaning, I'm going to wash my hands so that I could wear the sterile gloves. Now I'm done washing my hands. Now I'm ready to wear my sterile gloves. It is always to be remember that you have to keep the sterility of the catheter. Now I'm going to put a gel to lubricate the catheter. Now I'm going to lubricate the catheter for about 1.5 inches, but take note to be careful not to plug the eye of the catheter. If this opening becomes black or obstructed, it can lead to inadequate drainage of urine. This can result in discomfort, pain, urinary retention, and even complications such as urinary tract infection. To pick up the catheter at least 3 inches from the tip of the thumb to guarantee the aseptic technique and to avoid contamination during the catheter insertion or care. You must hold the catheter at least 3 inches away from the tip the thumb. It is a component by a larger initiatives to hold the patient safety, prevent infection, and deliver high quality medical care. Now using the thumb and the finger, I will gently separate and pull the labia majora of my patient so that I can see the urethra. Now I'm going to insert the catheter in the meniscus for about 2 to 3 inches or until the urine flow. Now, using my other hand, I'm going to remove the eye sheet. But in this technique, you have to be careful not to touch these sterile gloves you have. Using your other hand, you could pinch the catheter and dump this away. Now that I'm done and this catheter is been inserted already, I had to keep my hand here because I'm pinching the catheter so the urine won't flow anywhere. On my other hand, I'm going to connect the catheter bag before on the other hand, I'm going to connect the catheter bag before I'm going to inflate the balloon. Using the 10 cc of sterile water using 10 cc syringe, I'm going to inflate the balloon. This type of catheter is bent a little, so you have to be very careful by inserting this needle, because this type of catheter you have to insert coming with a needle. Oh, diba? As you can see, the balloon is already inflating, and this one, it won't remove already. Now, secure the bag to not movable part of the bed. This bag, it's coming with a hook, so you could put this in and hook it on the side of the bed where this part of the bed is not movable, and get the tape to attach the left cord to the thigh area of your patient. Place the patient comfortably. And ask how she feels or if she has any question. Ma'am, we're done putting your catheter. Do you have any question or clarification? Okay, ma'am. Thank you. And if you had any clarification or maybe question, I will be around and just call me. Thank you, ma'am. After that, I'm going to take off my gloves and apply the hand washing. Now that I am done washing my hands, I'm going to document all the procedure that I have been doing or done to my patient. And that's all for today. Thank you very much.